so we're just going to do a little clip here, and it's not particularly about any particular modality of working on people in complementary health, and nor is it particularly about any particular conditions. It's talking about the whole principle of conditions, treatments, cure, and imbalance. Okay, so to do that conversation, I'm going to talk to you with a foot, a tensegrity model, and an onion. Okay, so you come along to see a complementary health practitioner and they smile at you, and you might think, what am I here for? And you might think, I don't believe in all this stuff. And that complementary health practitioner might have a list of in inverted commas, conditions. We're not supposed to talk about conditions. So you might see another complementary health practitioner who doesn't mention conditions and talks about things like stress and imbalance and so on. And you might think, well, this person clearly knows what they're doing and this person doesn't, for whatever reason, okay? But basically what we're talking about when you come to us for holistic health is we're looking at whole body health. And whole body health means you could come in and go, I've got plantar fasciitis, okay? So you're happy, you've got a condition, and you arrive to me, and what I hear is I hear plantar, the sole of your foot, fascia. It's an element of soft tissue that's in amongst the rest of your dermal and soft tissue, muscle, tendon, ligament tissues. Itis. The British Medical Journal actually said quite a few years ago now that plantar fasciitis is not an itis. What that means is it's not an inflammation, okay? Which means we're just left with plantar fascia as a word, or a pair of words, telling me there's something the matter with the sole of your foot. That's all it tells me, okay? But plantar fasciitis, that's all it tells me. And I ask myself, why is there something the matter with the sole of the foot? Quite often, if we look here in terms of the sole of the foot, as you can see, the soft tissue is built up round here, and there's a lot of layers of soft tissue here, and there'll be loads of fascia in there. But it's not necessarily itis, or it might be itis, inflamed, okay? But it's telling me that there's something the matter with the sole of your foot. But because I look as a whole body, holistically, I might notice your shoulders higher. I might look at this tensegrity model, which is supposed to represent our body. So here we are, here's my shoulders and my pelvis. I might notice that my shoulder, or your shoulder, should I say, is up here. And your hip on this leg is down here, okay, in this tensegrity model. And as you can see, it's put everything into a parallelogram. So I might expect to see that you've got a short leg on this side. And I might ask you, and you might say, oh yes, I wear an orthotic in that one. This leg, in inverted commas, is longer because of the tilt, which we've talked about before. But I'm not going to need to look at the sole of your foot to correct that. I'm going to need to look at why is your body like this? Because if we then correct that, then everything else goes away on its own. Okay? And we have the same thing with things like headaches and cure, in inverted commas. Okay? And with cancers. Is cutting out a cancer curing it? Or is it simply cutting it out? Is a headache being caused when we give somebody a painkiller, is that curing a headache, or is it simply masking the reason for the pain until the pain has gone away on its own? If you come to me with cancer, clearly I'm expecting the medical profession to step in. But if you come to me with a headache, and I know that you've gone through necessary processes, hopefully your holistic health practitioner is red flag trained and so on, and is making sure that if you always come to a complementary health practitioner, if necessary, we route you through the medical side instead. But apart from that, if we're talking headache, I'm asking you what's happened to your body that might have given you a head injury. So that head injury might have been falling off a horse, it might have been a car accident, or it might have been banging your head as you brought the boot down on your car, or it might be nothing to do with that. It could be coming from tensioning on your neck, because here is your neck coming up here, and all this round here, the bones inside are small, the rest is all soft tissue, and the tensioning coming down round here onto the jaw, the pterygoid, the masseter muscles. If you grind, if you see someone with their chin over to one side, if you look at me, and you look at kind of on newsreaders and things, and you start to see that the chin is over, we know already there's some stuff going on which is either up in the neck area or the base of the spine. And so when you're coming to a complementary health practitioner, we are looking at your health onion. At first sight it looks like an onion, but we have all these layers of things that have happened to you in your life, and the more we know about those, the better. So what we do is we start to peel off as we do the work, and gradually we're getting back to when some of your issues began. So that can be somebody had a coccyx injury when they were 10, when they were kicked. This is by somebody playing football. Or they had a head injury where they fell off a swing or a piece of play equipment when they were younger. And so sometimes knowing that, we can go straight to the middle, but often we have to go through a process of working with the client at what the body is showing at each level, and dealing with what's presented, then taking another layer off. And gradually we work back through the onion. Sometimes we can find that the client has had, say, 2 sessions, and they're experiencing, and they say, it's just like the shoulder pain I used to have when I was 15. At which point they're telling us, we're back 15 years, because we know they're 30. And it means we've peeled all these layers off in one go. And it's amazing how often that happens. And that's whether it's herbal remedies or aromatherapy or reflexology or Bowen or any of these, where the practitioner is working in a very holistic manner. We're monitoring for the whole, and what layers have we got to get through to promote healing and restore balance.